The network of Texas IAF organizations, NTO, consists of 12 broad-based affiliates that are organized around issues affecting families, including healthcare, education, workforce development, and immigration. On February 20th, 2013, 200 leaders called on our governor and legislature to expand Medicaid. Interfaith clergy, leaders, and county officials gathered on the north steps of the state capitol for a rally in support of healthcare expansion. This rally was a continuation of a statewide strategy to work with local counties to pass resolutions in support of a Texas solution for healthcare. 6.1 million Texans are currently living with no health insurance, the highest ranked state in the country. If we expand access to healthcare, 1.8 million Texas residents who live without healthcare coverage would qualify. This means they would be able to seek preventative care rather than only seeking treatment in emergency rooms. This would save Texas millions of dollars. The federal government would pay 100% of the cost of Medicaid expansion the first 3 years. This coverage would provide health care to individuals who make less than $15,000 a year and to families of 4 making less than $30,000 a year.
I'm here because I am concerned for my 55-year-old brother, David. David has a wife and 2 children. He has developed a mass behind the back of his head, the size of a melon. His doctor tells him he needs surgery, but he can't afford it. Medicaid denied him because he works. He is one of thousands in Texas that will fall in the cracks with no health care coverage.
You're going to send your federal tax dollars to Washington for Medicaid expansion, regardless of what Texas does.
These are our dollars. They need to come back to Texas.
We need to stand collectively together and say, Governor Perry, pay attention to our Texas families. Do not send our money to other states. Keep it here and take care of those who we are tasked with representing.
30% of people in Bexar County are not covered. What does that mean to Bexar County Hospital District alone? We have 55,000 people that we carry on our CareLink program. If we got Medicaid expansion, half of them would go off. It would mean $52 million to the taxpayers of Bexar County, which means we could cut the tax rate.
This is economic development and social justice. This is health care that makes sense.
Unless we do this, we all know that all of these funds will go to other states. Our own hard tax dollars going to other states.
The network of Texas IAF organizations calls on our legislators to stand up for Texans and find a solution to cover the 1.8 million citizens not covered by the ACA. NTO will continue to work on this issue at the local and state level, whether or not a healthcare solution passes in this legislative session. Under the Affordable Care Act, there will be many changes and a great need to educate and organize around healthcare issues. The network of Texas IAF organizations is committed to improving the healthcare system across the state of Texas.